A very good morning, everybody. We had never thought that we would have this day today when Sir is not there, and we have actually devastated by his sudden demise. But what a wonderful thought of Dr. Vijayakar that, like, it's a irreparable loss to all of us, the entire homeopathy community, the entire humanity, human race. It's an irreparable loss, and what a wonderful healing we can have only by giving or spreading this knowledge to everybody, to budding upcoming homeopaths, to the practitioners, to everybody, the right kind of a knowledge. And that would be, you would be very happy. This was Dr. Vijayakar's thought, and it's a very thoughtful thing that, and first batch, like, I'm so happy that, like, they have given me this chance, opportunity to talk to this lovely batch of ladies. So, I welcome you all. I'm Dr. Vijayakar, and I consider myself very fortunate enough to have been associated with Dr. Vijayakar for the longest time, almost around 29 to 30 years. So we had a very long association, and again, I'm not here to teach you all. I would like to share my experience, whatever I have learned from him in the last 29 years. I would like to share that experience with you. So with this, first of all, we would like to pay tribute to Dr. Sadhna, because of whom, like, we are under one roof. And then I would like to take blessings of Sir. He is my mentor, who is like a father to me. So first I would share my experience. Like, it was during my internship days. Like, I have been attending his OPD since my college days, from probably second or third year. But during my internship days, like, like all the students are knowing, like, if you are a doctor, like, if you have finished your HMS, people around you would like to come to you for some opinion, advice, as if you are a doctor, complete full-fledged doctor. So similarly, I had my experiences. So when I finished my PhD and I was doing my internship, so that time one of our family friends, he was diagnosed with a brain tumor. And then they had taken opinions of the biggest, all the topmost doctors in Bombay, and everybody has advised them that you have to undergo operation. And then in fact, his hospital was also booked, operation theatre was booked in Nanapi for a certain day, and he was so frightened of that operation. So he came to me with his reports. As a young graduate, like, I could not understand anything. And he said, like, I don't want to undergo the operation. Do you have something? I said, like, how can I was just a fresher, and like, I didn't know whether homeopathy can do anything in that or not. But in college, like, I had attended Sir OPD. We had heard about him that, like, he is known for, treating those incurable hopeless cases since then. So I just told him, we can just go to him and we can take his advice. So I booked the appointment with Sir, and I still remember that night, in the 10:30 in the night, I was in Sir's cabin with all the relatives of that patient, and Sir had, that assistant had presented the case, and Sir had given the medicine. I still remember the remedy was lachesis, and he gave the medicine, and there was nothing. Then the family expected me to ask Sir, now what next? You given the remedy. Next day his operation theatre was booked for the operation. So I, I was so scared that, like, I just asked Sir, what do you expect in this case? And Sir casually said, what, cure? Means I was angry with Sir. That, how can he be casual with case like a brain tumor? How can you have means all those doctors are waiting for him to operate, and how can he be so casual? But he was like, he just laughed and said, you can expect a cure. I was angry, but then, like, I realized my foolishness, or I realized his conviction behind that casualness.
Only after I started following up that case, that patients, all the symptoms definitely started gradually reducing. Of course, the next day, definitely when the patient heard that he can be cured, he cancelled the operation. And gradually, I think within 1 month, we had taken out his MRI and the SOL had reduced. And gradually 6 months later, everything had resolved. Now till date, it has been I think almost 25-26 years, the patient is hale and hearty. And now that day when I spoke to him, I told him about Sir's demise. He has written a beautiful poem about Sir. Means like the brain is so active and so creative. That is the magic of homeopathy. That is what has attracted me to Sir. You know, he has that magnetic force, he had that conviction. Now where does that conviction come from? You know, we all have been taught in homeopathic colleges, but that conviction I had never seen in anybody. You know, to tackle such kind of hopeless or the incurable cases. That was his conviction. Now, where does that conviction come from? And one more thing, Sir has given name Predictive Homeopathy. Now why predictive? This is what he has taught us, like from day one. That time it was not there, predictive, but then we could learn from him that like he had predicted that the patient will be cured. Now how did he know that, like what? He was not an astrologer. He could predict because like he had conviction in his pathy. And when that prediction comes, when you are confident about your subject. So like what is predictive? What is the meaning of predictive? To predict is to foretell. Beforehand you are telling something. Okay, there is a difference between a foretell and forecast. You know, forecast also you tell beforehand, but usually like forecast is what there is always an element of doubt. You know, you forecast the weather department forecast, but many times we know it never happens. When they start like it would rain, it might not rain. So there is always an element of doubt. But whenever you are foretelling something, you are sure about that subject. It is like a mathematics. Now what is mathematics? In mathematics there is no element of doubt. 2 plus 2 has to be 4. It cannot be 3, it cannot be 5. So all the mathematical equations are predictable. You know this event is there, no, after this, like it has to be there. So similarly, Sir, that's the reason Sir has given the name Predictive Homeopathy. So where you are very sure about the subject. So one can foretell only if the subject itself is completed and mathematical, and one has a comprehensive knowledge of that subject. Then you can confidently tell about something. And there is no scope for empty speculation. Like in homeopathy, there is no scope for empty speculation. It has to be mathematical. So can homeopathy be mathematical and predictable? That is a question. Now we all know that homeopathy is based on what? Nature's law of cure. So is nature mathematics? Is there any mathematics in nature or the universe? Man is part of this universe, or man is part of the nature. Okay, so we have to talk about the universe. Is there any predictability or mathematics in universe? Yes. In universe, whatever astronomical activities are happening, they are predictable and they are mathematical. Like sun, like or the earth moves around sun in how many days? 365 days. It takes exactly 365 days for that one round. Similarly, moon revolves around the earth in 28 days. Okay, similarly the earth revolves around itself in 24 hours. Okay, so it is all mathematical. After day there has to be night, after night there has to be day. So this is mathematics in universe. Similarly, the comets come near the earth. Now we know about the Halley's comets. It comes exactly after 76 years. So this is also mathematical. So after 75 years you can predict that next year the Halley's comet would be there. So this is like predictable and mathematical in universe. When we come down to earth, what is mathematics on earth? All our seasons, now we are having winter. So we know after winter there would be spring, there would be summer, then in India there would be monsoon, in other countries there would be fall and again winter. So this is like with few variations here and there, but it has to be, it is predictable. Okay, it is predictable and it is mathematical. Similarly, like if you sow a seed, what happens? What do you expect from that? A plant or a sapling. Okay, that sapling grows to a tree, then it flowers, then you get the fruits and again you have the seeds. So this is a cycle, this is a rhythm. Nature has that rhythm and that rhythm is mathematical. Okay, so like we have the mathematics in universe, we have mathematics in nature. Now man is a part of this universe. So since man is a part of this nature, man has to be mathematical. So what is mathematics in human being? Everything, no? Human being, first of all, our anatomy also it is mathematical. We have to have 2 eyes, 1 nose, 1 mouth, 2 extremities, lower extremities, 2. If one is missing or one is extra, we call it abnormal. Something is wrong with that person. Okay. Now this mathematics starts from the day 1. As soon as a child is conceived in the mother's womb. What is the mathematics? You know when the child will be born, no? It is mathematical equation that you can, the doctors tell, no, like after 9 months and few days, like the variation would be there, that individual variation. But then we know after certain days the child would be born. We can tell them beforehand. Similarly, the child's every growth inside the womb is mathematical. Everything, when the anatomy is formed, when the physiology starts in the womb, that everything is mathematical. That's why like the doctors take the sonography, okay, after certain interval to see whether the growth is going in a right direction or wrong direction, or something is a problem. If something is missing, some mathematical equation is not there, that means something is wrong with the child. Okay, so everything is mathematical. So after the child is born also, what is mathematics? Even the development of the child is mathematics. Like the child's, all the milestones, we know when the child will start holding his leg, when he will sit, when he will start crawling, when he will stand, when he will start walking, his teething, it has to fall in certain time. Then only we can term that the child is growing normally. Okay, even now in this also, if the presentation also has to be the vertex presentation, that is a normal. If it is opposite, they call it as a breach. This is a breach of law. This is breach of nature's law. Nature has given that it has to come out through the head presentation. Okay, so everything is mathematics here. Similarly, as we have seen after birth, all the milestones, even your menstruation, when the girl matures, like we know after certain years, like she should be getting menstruation. Okay, so this is also you can predict it. Or even in boys' case, like when the vocal cords will develop, when the voice will be hoarse, when they will start getting the mustaches. So this is a maturity that also comes after certain time. So this is the mathematics. Now we know that there is a mathematics in the human being's growth and development. Similarly, when the person is in health, is there mathematics? When do you say the person is healthy? When all his parameters are normal. Like when we know all the biochemistry or your hemoglobin level, your blood sugar levels, your lipid profile, your creatinine level, your sodium, potassium, everything, all the biochemistry has to have certain figures, the certain range. Then we know, then we say that the person is in healthy condition. So when that means the homeostasis is maintained in the body. Okay, the person is in health. Similarly, you can predict, this is all predictable since it is mathematical. When something goes wrong, you know, like if the blood sugar has gone to 500, you know the person has diabetes, something is abnormal in the body. It is not going as per the mathematics or as per the health. So similarly now, like in health, similarly we can predict the nature of a person also. If certain, like you know the person, if you know the person, certain behavior of the person, then you know like how his next action would be. An angry person is there, you know that person is sensitive to. If somebody pokes him, you know what he is going to be, what reaction he is going to give. Whether he is going to be angry, he will throw things. So you can predict the nature of a person also. So as we know that when there is a mathematics in health, mathematics in mind, similarly there has to be mathematics in disease also. Sir has of late beautifully correlated all the pathologies with your mind. There is a pathology of mind also. Okay, so from the pathology itself, from where is the disease, the located, or what kind of a disease the person is having, you can predict what problem the person must have gone through, which side affection is there of the person. We know if the person is having on the right sided affection, we know that his sensitivity is towards either his partner or toward his business or toward his friends. If he has any of the left side affections, we know the person may have some problem with his family that is like close to heart, that is his children or his mother or his house. So this is all predictable. So this is mathematical and predictable. So same way, if there is a disease, mathematics in disease, there has to be mathematics in cure also. That is what like Dr. Vijayakar has beautifully correlated this chart of suppression with your embryological origins. Okay, from which part of the embryology the organ generates. So accordingly he has given the chart of suppression. Okay. So now, can homeopathy be mathematical? Is there a mathematics in homeopathy? What is the homeopathic mathematics or what is predictable in homeopathy? What are things we can predict? Sorry? How to take cure will take place. What else?
Prediction of the cure. Like next symptoms, what will be the next symptoms?
Yes. What else? Yeah, that is like we all are talking about the Herring's law. That means like we can predict when we give a simillimum. We know we can predict to that patient that what you can expect next. That is like if the person is coming with some acidity problem. So we know what we will tell him. He may get that respiratory infection or some little bit of cold and cough, or like he may get some skin eruption. But if in the follow-up, the person comes up with some joint pains. We know that, we can already predict that. It's a mathematical thing that like we know that our medicine is somewhere it is wrong. So it is going in that opposite direction. So we need to change the direction, which need to change the medicine. That is what the beauty like this of homeopathy, and this is what like Dr. Vijayakar had always been telling us, that we should know which direction we are going. And like if he always says that like when we if you had to come to Khar now from wherever you are coming, if you are coming from Borivali, you take that train. So how do you know whether you are in the right direction or wrong direction? If the next station is Kandivli, you know you are going in the right direction. But if next station is Bhayandar, you know definitely you are going in a wrong direction. So you need to change the train. You have come to the wrong train. Similarly, even in Helling's law, what do you say? We have these destinations. All our systems, all our organs are nothing else but our destinations. So we know that from the disease has to go from more important organ to the less important organ. Okay, but if it is going in a reverse direction, we are 100% sure that we are wrong, and there is nothing wrong in being wrong, but we need to accept that fact and change the medicine. Okay, we are not gods, we have to accept. That is what the sir kept on telling us, that like first you have to make mistakes, but then understand that mistake and correct that mistake. Unless and until you make mistakes, you can never learn things. Okay, so you have to make mistakes, but then you have to accept those mistakes. You should not have that ego, no, my medicine is right only. If the patient is telling this is wrong, he's going into a wrong direction, you know, you have to change the medicine. So Helling's law is one thing that is absolutely mathematical. With that, like, we can predict everything. Our whole base of our practice is a Helling's law. So what else is mathematical in homeopathy? Potency. What else? Like when you are taking a case in a patient. See, like so many times it happens. I mean, during you all are college students or passed out, or doctors. Your fourth year. Okay. So it happens, you know, even during college, like you have not full knowledge, but still you need to prescribe certain times. You know, you are forced to prescribe by your family and friends. So you, with your knowledge, you prescribe something. Suppose you prescribe Moxol to a patient, okay, to your relative, and it worked. Okay. So what you can predict now? Cure. But then what do you know now? See, you had not even taken the history of the patient. You have just prescribed.
The medicine is right.
Medicine is going in a right direction. That means what? That means you know that this patient has to be defined. This patient has to be dominating. This patient has to be positive. So, like you know mercury salt picture, and if it is working, that means that those features has to be there in that patient. It is so mathematical. Similarly, when you are taking a case in your clinic, okay, suppose you are taking a case and like after certain time you feel that this patient could be lycopodium. So what you can predict now? You can directly ask him, do you have 4 to 8 pm aggravation? If he is lycopodium, it has to be there. It is the mathematics. We know that the lycopodium has 4 to 8 pm aggravation. If this patient is lycopodium, he has to have that aggravation. He has to have the craving for hot food. So this is so mathematical. You know, there are certain times like we have to ask direct questions. Okay, so this helps us. Okay, similarly, if the patient is like you can predict the modalities of the patient. Now, arsenic patient is there. We know that like if he is arsenic, he would have that midnight aggravation. So you know when to give the medicine, when to give that dose. During aggravation, you should not be giving, no? So midday, midnight aggravation has to be there in that. If the sulfur patient is there, we know that he has to have burning souls, right? So we can directly ask, after certain time of case taking, we can directly ask these questions to a patient to confirm the remedies. Okay, if it is not there, then you know this is somewhere close to that remedy, but it is not that remedy. Okay, so this is the predictability and this is the mathematics in homeopathy. Okay, if the person has on the right-sided affection, from that, or the left-sided affection, from that also you can predict the nature of the person. Like right-sided remedies are what? They are usually business-minded, very positive, very practical people, then very analytical and critical. So this is the predictability. See, suppose so many times it happens, you know, like patient is not giving history at all. We are stuck, like what to give. You know, that's what like sir always used to tell us, that you can get symptoms from anywhere. It's only your antenna should be open. Patient is always throwing the symptoms at you. You have to have that keen eyes and ears to pick up those symptoms. So if the patient is not giving history, but you have only the right-sided affection, you know that this patient could be like this, and on those guidelines you can ask the patient. If the patient is left-sided, then patient has to be emotional, sensitive, he could be a very creative person, he could be poetic, could be crying more. So from this, and he is less money-minded, he would be could be a timid person. Of course, the exceptions are always there. Okay, so we come to know a lot of things from this. Similarly, from the types of injuries also. From where is the injury? What kind of a injury? From the look of the injury, you can come to know the miasm. Miasms you can predict. What could be the psoriatic miasm would have what? Physiological or the clean-cut injuries. Clean-cut injuries that heal so well that there would not be a scar also. And psychotic would be, there would be inflammation, there would be accumulation or the pus formation. Okay, and it heals with the scars. And the syphilitic would be disorganized. Absolutely, it takes a lot of time for healing, or it does a non-healing ulcers. These are all absolutely syphilitic. It would be probably offensive. It doesn't heal properly. Okay, or even the compound fractures. This is this the person has a syphilitic trait in him. From the injuries itself come to know the person is whether psoriatic or syphilitic or psychotic. Okay, so this is also predictable in homeopathy. So in basically homeopathy, what do we do? In homeopathy, we take the entire history of a patient, okay, and draw a picture, a patient's picture, and what do we do with? We have a remedy pictures. So basically, we are matching that the patient's picture with the remedy picture or the remedy symptoms of the remedy, and if it is matches perfectly, we know that the cure has to happen. So this is nothing else but the mathematical equation. We have to do that matchmaking of the drug picture and the patient's picture. So that is what is predictive in homeopathy. And this is what Dr. Hahnemann has given in footnote number 106 also. That at first, about 40 years ago, I was the only person who made the proving of the pure powers of medicines the most important of his occupations. Since then, I have been assisted in this by some young men who instituted experiments on themselves and whose observations I have critically revised. Following this, some genuine work of this kind was done by a few others. But what shall we not be able to effect in the way of curing in the whole extent of the infinitely large domain of disease? When numbers of accurate and trustworthy observers shall have rendered their services in enriching this, the only true materia medica, by careful experiments on themselves, the healing art will then come near the mathematical sciences in certainty. This is what Dr. Hahnemann also mentioned, that homeopathy is a has that mathematic certainty. Okay. Now, if we want to understand homeopathy, first of all, most of us, like most of college students, you get attracted to the modern science or the allopathy. The first preference is always for the allopathy because it is modern science. But we need to understand that homeopathy is the youngest and the latest science. It is just 250 or 60 years old. Okay. There is no other therapeutic science that is developed after homeopathy. Homeopathy is the last therapeutic science as such. So that has to be latest. And we all know why did Dr. Hahnemann had the need to develop or discover homeopathy. He himself was an MD, allopathic doctor, MD medicine, having a roaring practice. But then he gave up his MD degree. Why? Because he was not happy with his treatment. Because he could not cure the simplest of the diseases, even the asthma or blood pressure or such diseases also he could not cure it. He could only control it. And whatever the treatment that time was there, with that like the patients were coming back with the same ailments and with the more severity. So he was totally not satisfied with that treatment. That's why like he felt there is a need to find out, discover something else. So he definitely, like if you want to upgrade a system, now if I have a Maruti car, okay, if I want to go for another car, definitely I would go for the higher model or some different car with the good power and good performance. So I will not go for the lower. Okay, so whenever like the science is upgrading, you whatever the follies of the earlier science, you try to solve them or you try to upgrade them. Similarly, Dr. Hahnemann had come up with this science, the homeopathy, the supposed to be latest science. So he had developed a new science with the new technique, so it has to be advanced science. So homeopathy is definitely advanced than allopathy. So first we need to understand what is the difference between allopathy and homeopathy. So what is allopathy? What is the basic difference of allopathy and homeopathy? Principle. What is the principle of allopathy and what is the principle of?
They give any kind of treatment depending on the disease.
Yes.
But in this we have similar symptoms.
Yes. So what is the basic difference?
So they are not following any principle.
You can't tell this to them. See, basic difference is what is our principle? Like cure by like. Yeah. So basically what do we do? We treat the man in disease and they treat the disease in man. Okay. So what do you mean by that?
They only see the disease part.
Yeah.
Prescribe on that.
Yes.
They do not consider the whole man and
Yes.
the whole man is involved in that process. They do not consider.
Yes. So when we consider a whole man, what do you mean by that? What do we do?
Individualization. Disease is only the last end product, but the disease process paralysis start with the disease process. The man is involved in this.
Yeah. But when we say that the basic principle, our basic principle is man in disease, what do you mean by that? We treat the man in disease.
In allopathy, different people suffering from the same disease will have same treatment. But here, if the diagnosis is same, even if the diagnosis is same, the remedy which is given can be different.
Yes, definitely. So that is what is man in disease. But when we say that we are treating a man in disease, I am treating you. What am I doing?
The tendency of the person to develop a disease. I think.
Yeah, what is the tendency? What else?
We are treating the similar symptoms as a similar medicine.
Are we treating just symptoms? No. We are treating the entire man, no? That is the basic difference. No, we are not giving only on symptoms. See, if a person of, suppose say asthmatic person comes to me, okay, or comes to you. If suppose like he goes to an allopathic doctor, what he will be treated? Yes, so he will be given a bronchodilator, something for his cough, some antitussive or some cough syrup, some anti-allergen, some anti-inflammatory. So they are treating every symptoms. If he comes to us, what we will be doing?
Taking the whole case and giving a constitutional.
Yeah, but that constitutional remedy, the constitutional remedy would be?
The immune system.
Exactly. Exactly. So what we are treating is nothing else but the immune system. See, we know that the man has survived this earth for so many years. Billions of years man has survived on this earth. There were no doctors, no. God never sent doctors when man came on the earth. Doctors came into existence few thousand years, maybe 5,000-6,000 years old. Okay, maybe the allopathic, ayurvedic or homeopathic doctor. They are just recent. But still man survived so many billions of years because of what? Because of its immune system. No, he was exposed to everything. That time also viruses were there, bacteria were there, so definitely they also got these infections. So how did they survive? Only because of the immune system, or that is an internal doctor within. So all of us are born with that internal doctor within us. So when that doctor falls sick, or like he is not, that immune system falters. When that immune system is not take care of yourself, you fall sick. Now even in this COVID, not everybody has got COVID. Few people whose immunity has gone down would develop that infection. It is applicable for each and every disease. Okay, if something goes wrong with you, then only you will catch that disease, not otherwise. So if your immune system is good enough, you don't have to worry about anything. So basically in homeopathy, what we consider is the immune system of that person. When we take the whole case history and find out some remedy for that person, when we give that remedy to that person, what we expect that it is nothing else but the stimulus for that immune system. So that person's immune system gets better and it takes care of itself. So our diseases don't cure, our medicines don't cure any disease. Our job of our medicine is just to stimulate the immune system of that disease individual, and then his body recovers and his body takes care of any disease. That can be anything. So that's why like we don't give antihypertensives, we don't give anti-hypoglycemics, or we give that one medicine for that person for his immune system. So basically that's the basic difference. The allopaths treat the disease in man, whereas homeopaths treat the man in disease. Okay, and that's then what is the next difference? In medicaments, again, like what are their medicines like? Against the disease. They are the specific for the symptoms. They are in the very crude form. Okay, what medicines, what kind of medicines we give? The potentized or the dynamic medicines. The potentized medicines. So in allopathy, that's the reason they need to give, since they are treating symptomatically, they need to give higher or the repeated doses. Now you cannot give one dose of antihypertensive and just forget about it. No, like if the person misses one dose of antihypertensive, tomorrow his blood pressure is going to shoot up. Okay, is it the case with us? No, we will be giving a single dose or a few doses. Okay, that can bring down his blood pressure. Okay, so, similarly, what is the difference between is there a difference between in the case history? Yes, what is the difference? Yeah, but then in history what do we give more importance to? Mental symptoms. Then the generals. What are the generals? Your appetite, your sleep, your cravings, your aversions, your bowel movements, your urine. Then other like mental picture of the your entire history. What are your how do you react in every situation? So you take care of all these things, whereas the allopathic doctor would be only asking the particular things, the history related to that, the symptoms, that's it. Whereas we take the most detailed case history, where we also give importance to the particulars, but then that would be next. Okay, first our most importance would be for the generals and the mental picture. Okay, then what is the difference? Is there any difference in the follow-up? Allopathic and homeopathic follow-up. Again, what? Herring's law, yes. First we need to follow up the Herring's law. We have to follow the Herring's law, which they don't have. Okay. So that's what, like if a blood pressure patient goes to an allopathic doctor, he just want to check the blood pressure and see the particular things, but we need to understand the whole, again like our follow-up is also has to be in detail. We have to understand if the patient's generals are better or not. His mind is better or not. Suppose like I have given a medicine, patient's blood pressure has come down, but patient says like I am feeling very lethargic since the time I have started the medicine. Though my blood pressure is come down to normal. So is it a good follow-up? No, it's definitely a bad follow-up. I know like I need to change my medicine. If the patient says like my sleep has disturbed, no, this is again wrong. His appetite is gone down since the time I have started the treatment. No, definitely it is not acceptable. I have to change the remedy. But if the patient says like that, you know, after taking the medicine, I have started feeling so good. You know, like I feel I have an extra energy. I started eating, which I could not eat for so many days. But then still the blood pressure is still on a higher side. Then is it a good follow-up or a bad follow-up? You have to wait and watch. First the generals only have to get better. When the generals get better, we know that the immune system is getting better. See, we are not giving anything to push the blood pressure down. The body has to bring it down. So if the patient is feeling better, generally feeling better, it is a good sign. So we have to wait and watch in this case. Okay. Similarly, yeah, we have seen in case history follow-up. So we need to know that the homeopathy is exactly opposite of allopathy. Okay, it's exactly the mirror image. We have to do the exactly opposite thing. And we need to understand that our medicines do not cure any disease. We don't have any medicines to cure cold, cough or asthma or acidity or anything. For cancer, we don't have any medicines for that. We need to stimulate the system so the body cures itself. Okay? Now we know that this was the what happened like during sir always used to tell that one story. You know, like when during old times people used to fight these wars. They used to fight the wars with the swords. Okay, and when the technology changed, the guns came into picture. So in the swords, what used to have, there was man-to-man battle, combat. Okay, you have to go near the person and kill him. Okay, but with the guns, what happened? You just have to stay far and shoot at the person, and like the victory is definitely yours. So, like when this technology changed, the soldiers were trained. They were trained into that, like to in the shooting the guns. But then during the war, what happened? The soldiers, they forgot the technique and they started using those guns like the sword. You know, the big guns like the sword. So what will happen? Obviously, it was not sword. Na? The other party who had sword, they killed them. So they forgot the technique and they used the wrong technique, and that's why they failed. Similarly, we homeopaths, what did we do? Homeopathy was meant to be for man in disease and not disease in man. But in between, people forgot the technique, the principle. They started what? They started treating with homeopathic medicine with the allopathic principles, like giving specific for the particular diseases. Like if you have fever, give belladonna, aconite, or if you have acidity, give lycopodium, something like that. So this specific. So they have forgotten the technique. So how it will work? And then we say that the homeopathy fails. It is like the sir always says that it is not the homeopathy never fails. It's the homeopath who fails. That's why like the some homeopaths like him, he could treat incurable diseases with ease. because he knew the technique of homeopathy, how to use those medicines. And most of the people, like, they use the homeopathy with the allopathic medicines, they fail. That's the reason they fail. We know that the homeopathy is the most modern science. Hahnemann had developed this science as the most modern. So what is the most modernness of about the homeopathy? What is modern about homeopathy? Which is not there in allopathy. What is the modernness of homeopathy?
Gentle cure.
Huh?
Gentle cure.
Gentle cure. What else? The crux of homeopathy. What do we do? When we say we are individualizing thing, that means what are we doing? It is based on what? It is based on your genes. The genetics is the ultra modern science, and like that is the time 200 years back Hahnemann had thought about, when there was no electron microscope also. He had thought about the individualization. Now what individualizes us? Everybody, our genetic code. Now the Harrison books also mentions that 95% of human genome is same. All of us have our genes, 90% would be same. It is that 5% variation is there in all of us. That individualizes us. And homeopaths have to deal with that 5%. Now genome is responsible for what? The way I look, the way my characteristics are, the way my behavior is, my attitudes are, my likings, my dislikings, my emotions, my reactions to any particular situation, my reaction to particular weather. Everything is genes. It is genes, and this is given in the genetics books. And this is what we do in our day-to-day practice. We are taking the entire case of the person. This is what we do. We are taking all the journals of the patient, all the mentals of the patient. So we are individualizing the patient. So genes is the most modern thing about the homeopathy, and we have to deal with that. Okay, we have to individualize every person, and that's the reason like homeopathy is the most modern science. Okay. And that's the reason it is homeopathy is predictable also and mathematical also. Okay, so with this we end. On time? Yeah, if you have any questions.
We started around 12:06.
Okay.
So we have 5.
Any questions?
I wanted to ask you, how is it like, how do you prove it?
What?
That you said that right sided people have particular traits and left sided people have particular traits. So how did you came to that conclusion? Like, how did you prove it?
So we have taken the histories of the patient. No, it is the right side. See, there is something known as, have you attended the modules? No. So in the module we teach everything. This is the right brain dominance and the left brain dominance. There is something. It is a proven fact. The scientists have proved this, that the left, that the left side, right side of the brain dominate your or controls your left side, whereas the left brain dominates your right side. So people with the right brain dominance are always the very sensitive people. So that would be having the left-sided affection. So they would be very sensitive. They would be very creative people. They would be. It's a proven fact.
And what about the cases where the symptoms go from left to right or from right to left, that way?
So that's what so we have particular remedies like that. Okay, people's now lycopodium symptoms would go from right to left. So, but predominantly it is a right-sided remedy. So we know that lycopodium is a very dominating person. It's a very business-minded person. There is an emotional factor also in lycopodium. It cries when thanked. So there is an emotionality also. But the predominance would be of that particular side. Similarly, Merck salt. Merck is also right-sided. All the problems you will get on the right side. Most of the metals are right-sided. Very few, like the ferrum, is left-sided, or platinum, which are very sensitive remedies. Though metals, but they are sensitive, so they are left-sided ones. But most of the right-sided would be, see, there would be exception. That's why, like, if you read the genetic materia medica also, sir has given, see, this is a more, we have this that right-sided would be strong and dominating. But then there are remedies, right-sided remedies, which are timid also. That's why if you read the genetic materia medica, all the remedies sir has given are right-sided timid remedies. Like calcarea, baritas, kalis, these are, we know, these are the very soft and mild and timid remedies, but they are right-sided.
What is the explanation for that exception?
So that is the individuality of that person. That's why, like, there is an exception for everything. So we need to learn that exception also. Now ferrum metallicum is a metal, though it is dominating, but it is left-sided. So that's why there is a sensitivity in that ferrum. Ferrum we say, na, it's a very sensitive remedy. Though it's an angry, but it's a very sensitive remedy. So that's why, like, we have, these are the individualization of that particular remedy. So the way we have the, as a genetic code, we have the individualization. Similarly, every remedy has the individualization. That is what we need to learn. More than the common symptoms, we need to learn these peculiar symptoms. So we, in homeopathy, we cannot generalize anything. But these are the certain things which we can, take help of for your solving the cases. It helps you in entering the case. Like when you are taking a history, if you have the right side, so you can go in that direction and ask the questions. Okay? Any other question? So, okay, thanks for listening so patiently. Thank you so much.